In this video, we are going to learn about finding inpatient codes useful for CCS exam. So the first example is the patient who underwent a right kidney transplant 3 months ago is admitted for biopsy because of an increased creatinine level. So percutaneous biopsy revealed a chronic rejection syndrome. So here the principal procedure is percutaneous biopsy. So it comes under the root operation excision. So first you should identify the root operation. Here the root operation is excision of right kidney. So with this term we should search in the index. So in the index excision and under excision kidney. Here our interest is right kidney. So kidney right. So 0 TB. So here we get a 3 or 4 character code from the index. Using this 3 or 4 character code you should go to the tabular form or tables. So here 0 TB table. So under 0 TB table, we have to complete the remaining part of the code using the details given in the patient's chart. So here 0 TB and 0 for kidney right and open approach 0 and no device. And here because the biopsy is for diagnostic purpose, here we should use characterization qualifier as diagnostic X, and that is according to the guidelines. See here guideline. Whenever we do any biopsy procedures like excision, extraction or drainage, the qualifier should be always diagnostic. For example, 5 needle aspiration biopsy of fluid is coded with the qualifier diagnostic, and similarly biopsy of bone marrow with qualifier diagnostic, and lymph node sampling for biopsy again qualifier diagnostic. So next example, patient admitted for corrective surgery for keloid of left hand due to burn experienced a fire accident 1 year ago. So here radical excision of scar was carried out and the defect was covered with full thickness graft taken from left upper arm. So here the principal procedure is excision of scar tissue and later defect was covered with full thickness graft. So here both radical excision and full thickness graft taken from the left upper arm should be coded. So first we should identify the root operation. Here the root operation is excision of left hand skin. So under excision, from the index under excision we should search for skin, and under skin we should search for hand. So 0 HB. So with this 0 HB, we should go to the tabular form or table. So 0 HB and under 0 HB, so fourth character will be Z, skin of left hand. Next, external approach X, no device. And here it is not done for diagnostic purpose, hence the qualifier will be Z, no qualifier. So in this chart, there are two procedures. One is excision of radical excision of scar and full thickness of graft. So after coding for excision you should code for full thickness graft. So this full thickness graft is coded to the root operation. Here replacement, because here we are replacing the scar tissue with the other tissue of other side. Here in this case upper left arm. So we should code for replacement of left hand skin with autologous tissue substitute, because it is taken from the patient itself. So here the full thickness graft. So under replacement, you should search for skin, and under skin hand. Again 0 HR. You should go to the tabular form or table 0 HR, and under 0 HR search for skin of left hand. So skin of left hand comes to G here. Next, external approach, and the tissue substitute is autologous tissue substitute, hence 7. And next is here the graft is full thickness graft, hence 3. So 0 HR, skin of left hand, X external, 7 autologous tissue substitute, and 3 full thickness graft. So here in this chart we should also code for excision of left upper arm skin, because here from the patient's chart the scar tissue was covered with a full thickness graft, and this graft is taken from the left arm. Hence you should code for excision of scar and replacement of scar, as well as excision of the tissue for full thickness graft. Hence we get here a third code, that is excision of skin of left upper arm. Again, first we should search for excision in the index, and under excision skin, and under skin upper arm, left upper arm. So 0HB. So table 0HB, and under 0HB next is we should search for skin of left upper arm. So skin of left upper arm goes to C. Next, external approach, no device and no qualifier, because it is not for diagnostic purpose. So the next is patient diagnosed with skin lesions on back are suggestive of HIV related Kaposi sarcoma. So admitted for incisional biopsy. Again biopsy. So incisional biopsy is coded to root operation excision. So under excision you should search for skin on back. So skin and back. So 0HB. So we go to the table 0HB and we should search for skin of back. So skin of back 6, and approach is external approach, device no device, and here the biopsy is for diagnostic purpose, hence X diagnostic. 0HB, skin of left back, external approach, no device, and diagnostic purpose. Next, a simple example, excision of pancreas. So we can directly go to excision from the index, and under excision pancreas OFB. So sorry, 0FB. Always remember this is not O, it is 0, because O and I are not included, in order to avoid confusion between 0 and O and I and 1. So it's 0FB, and next pancreas, open approach, no device, and diagnostic purpose. Next, resection of appendix. I hope everyone knows about the difference between their excision and resection. So here resection is a separate root operation. So under resection we should search for appendix 0DT. So 0DT, and under 0DT you should search for appendix. So appendix or vermiform appendix, both comes to J. And next approach is open approach and no device and no qualifier. Next, a patient was admitted because of suspected carcinoma of colon. Exploratory laparotomy was carried out and a significant mass was discovered in the sigmoid colon. The sigmoid colon was resected and end-to-end anastomosis accomplished. Small nodules were noted on the liver and a needle biopsy of liver was performed during the procedure. So note that here actually there are 4 procedures happening. First is exploratory laparotomy. Second is resection of sigmoid colon, end-to-end anastomosis of that sigmoid colon, and fourth is needle biopsy of liver. So here the point to remember is exploratory laparotomy is not coded. Next, sigmoid colon resection is coded first, and that is because according to the guideline here, see, the laparotomy performed to reach the site of biopsy is not coded separately. Okay, that means if the laparotomy procedure is performed to reach the site of procedure, then the laparotomy is not coded. So here exploratory laparotomy is done in order to resect the colon, sigmoid colon. Hence exploratory laparotomy is not coded. So first we should code for resection of sigmoid colon. So resection of sigmoid colon in the index. So under resection we should search for colon. So colon and under colon sigmoid colon. So 0, D and T. So you should go to the table 0 dt, and under 0 dt you should search for sigmoid colon. So see sigmoid colon n, and the approach is open approach, no device and no qualifier. So the next procedure is excision of liver. So excision, so directly we can go for tabular form 0 FB, and under 0 FB 0 for liver, open approach, no device, and the qualifier is diagnostic purpose. Here you should note that exploratory laparotomy is not followed because it is followed by resection of sigmoid colon, okay, and needle biopsy of liver is coded, okay. Then what about end-to-end anosmosis of sigmoid colon? End-to-end anosmosis is not coded because, see, according to the guideline, in case of resection of sigmoid colon, the anastomosis of colon to rectum is not coded separately. Hence, though there are four procedures, though there are four procedures happening here: laparotomy, resection, anastomosis, needle biopsy, only resection and needle biopsy is coded. Laparotomy is not coded and end-to-end anastomosis is not coded. So next is breast biopsies of stomach. See, breast biopsies of stomach comes under the root procedure, root operation, extraction. See, extraction, because here in case of breast biopsy, with the help of a brush we will scrape off the tissue of stomach. That means we are extracting the tissue of or a part of tissue of stomach. Hence the root operation here is extraction. So extraction of stomach via natural or artificial opening, endoscopic and diagnostic. These are all the details will be provided in the chart. So under extraction we should search for stomach, so 0 dd, and when we go to table 0 dd, and under 0 dd search for stomach, stomach here 6 via natural or artificial opening, endoscopic and no device and diagnostic. So if the chart or if the patient chart mentioned as percutaneous endoscopic or percutaneous, you should code accordingly, you know. Next important guideline, see, if the biopsy is followed by a more definitive treatment, then both biopsy and that more definite treatment are coded. Understood? If the biopsy is followed by a more definitive treatment, both this biopsy and this more definitive treatment should be coded. For example, in case of biopsy of breast, if it is followed by a partial mastectomy at the same procedure site, then both the biopsy and partial mastectomy procedures are coded. Understood? So next important note is excision versus resection. So complete excision is called as resection, right? See, but here in case of upper lung lobectomy is coded to resection. See, upper lung lobectomy is coded to resection, not excision, because here the upper lung lobe has a separate or a specific body part value. It has a specific body part value, and because of that, if entire upper lung lobe is removed, that is, if that means upper lung lobectomy, it is coded to resection of upper lung lobe, not excision of lung. This is very, very important.